Meow, I'm Huples cat. In a massive ongoing disaster where there is no healthcare, there are no doctors and there are no nurses around, what are you going to do if somebody has an eye injury? Well, hopefully you have a decent first aid kit. What can you do using a kit like this? First golden rule of a traumatic eye injury: treat literally everything else first. If the eye's hanging out of the socket, treat the broken arm, treat the crushed rib. Eyes can wait to the end. So you want to assess, you always want to assess. Let's assess. The way to do it is to check both eyes. There's nothing looking wrong with this one and this one's hanging out. You still have to check both eyes. Though I would argue if it's actually hanging out, you probably don't need to check it. Now, an unnecessary warning, I am not a doctor, I am a registered nurse. But even so, even if I was a doctor, none of the stuff I'm going to talk about in this video should you ever do. If you ever have a problem, if you ever have a medical issue, if you ever have an eye injury, go to a doctor. Don't treat yourself with antibiotics and certainly don't do surgery. This is a theoretical discussion about what I would do, not you, me, if there's a massive ongoing disaster and I can't get to a hospital and I can't find a doctor. So as ever, introduce yourself if you don't know them and ask them some questions. Have you noticed any loss of vision? Do you have any pain? Do you feel that you have something in your eyes? Do you feel you have something in this eye? If they have an obvious visual injury, ask them, do you feel like you have something in your eyes? If the answer yes or no, continue. Do you feel you have something in this eye? Do you feel you have something in this eye? Always check both eyes. The feeling of having something literally sitting on your eyeball is an extremely common symptom with chemical injuries. I think I might have this one. It's kind of bright today. Did he have any photophobia? This is photophobia in general. This isn't shining a light in. This is just sitting where they are. Is the light bothering them? If your poor victim has a cornea or an iris injury, photophobia is a very common symptom. Do you have any double vision? Can you see any obvious cuts, tears, bleeding objects in one or both eyes? Check both eyes. Did they have nausea and vomiting? Make sure they didn't have nausea and vomiting before the eye injury. If someone has a traumatic eye injury and they suddenly develop nausea and vomiting, this is not a good sign. It might be related to increased eye pressure. Bleeding inside the eye may not be visible, but it's pressing on the brain, causing acute nausea and vomiting. Now, obviously, if the person's aware of the fact they've got their eyeball hanging down the cheek, they're probably going to feel sick and faint and maybe even vomit a little bit. It's an acute, obvious sign if they have pressure on the brain. Is one or both of the eyes bugging outwards? Now, bear in mind, some people have this normally, so make sure you kind of know if it's normal for them or not. Having done the medical part of the questioning and made them calm, let's get into it. Have you had any trauma? Have you fallen over? Did you notice anything hit you? What were you doing? Were you sewing? Were you hammering? Were you welding? Were you sweeping out an old barn? Do you normally wear glasses? If they do, get the glasses. If they are broken, get somebody else, if you haven't got the time, to actually put the lens back together to see if there's any part of the lens missing. Have a very careful look at the ground. This is not going to be possible in a lot of disaster scenarios for this type of an injury. If you can do it, do it. There might be a piece of glass in their eye and they may not feel it. But if you can see there's no glass left at all and there's a piece missing, it gives you a clue. Can you move your eyes? Now they're just probably going to say yes. So you're going to ask them, hold your head still, look up, look down, look to the left, look to the right. If one or both of the eyes isn't moving, and usually it'll be one eye, and it may only not be able to move in a certain direction, this is a sign that they might have a fracture of the bones around the eye that is now trapping nerves, preventing the eye muscle from being able to move in that direction or any direction. Now you want to do general vital signs once they're stable. Temperature, pulse, respiration, blood pressure. Remember, you're looking for other traumas. You've got to treat everything wrong with them before you treat the eye. The victim has said that they can see. They said they're having no visual issue. Let's check that out, shall we? Cover one eye. Put your hand about 3 feet away from them and say, how many fingers am I holding up? And then do the same thing for the other eye. But that's not the end of that. Do the same thing again, but have a look if they can actually see around the eye, not just in the straight direction. Is there, I almost put myself in the eye. Is their pupil round? Some people have irregular pupils normally, so it's a good idea to know this. But for most people, they have round pupils. If they now have an irregular pupil, it means the iris is probably bulged into areas of tearing and cuts around the eye. Now here's one you might not think about. Can they close their eyelids? Can they open them fully? In the field, if you're transporting them to healthcare or you're transporting them back to base for assessment, remember eye injuries take low priority over every other injury. The first thing you do is cover the affected eye or eyes with a metal shield. You will have seen many films and you will have actually seen many videos where people wrap the head tightly with a bandage and a big pressure bandage over an eye injury. This is completely and absolutely wrong. I would argue if they wear glasses and the glasses fit and are intact, I would just use their ordinary glasses at this point, unless it was a very dramatic injury. But if they don't wear glasses and they don't have sunglasses available, you might want to put a shield on them. The idea behind the shield is to prevent further injury to the eye during transportation. Now there are very nice metal shields. I don't think I have one. You can get plastic ones these days, but definitely get a metal one. It's always a good idea, unless it's very cold or very hot. So I was welding 40 feet up on top of the roof and I fell off and my glasses are broken, but I don't appear to have any injuries. I fell into a huge snowbank. But on the way down, I smacked my head against the siding of the house and it hit about here, and I have all these scrapes here, and I'm saying my eyes bothering me. So you cover my eye with a metal shield and you check me for traumas and then you evacuate me. We'll worry about the eye when it's a stable situation. So how am I going to cover my eye? Now you probably noticed I have a bag problem, and I'm going to address the bag problem in a future video. But in the here and now, I've ordered 12 more of these. They were quite reasonably priced. This is a triangular bandage. When you open a triangular bandage, you can have it looking like this quite simply. This is going to be great for wrapping around the victim's head. I'm calling them a victim because you're treating them. You don't want the metal touching the eye. So if there's no injuries around, you can grab an object like this if it's near a house, which is a measuring cup, and you can put it on like that. Now obviously this is a lot easier to do if there's somebody else around. Well, how am I going to put a measuring cup over my eye? I'm not. First thing I'm going to do is get the bandage ready to go. The reason for this is this is going to be almost impossible to do unless you've got somebody to hold it while you're tying it. Don't worry about how it looks. Make sure the other eye is unaffected. At this point, get this in here, like this, without touching the eye, without damaging the eye, and then start to attach it, however it works. Now you may need a second triangular bandage, which is why I've ordered 12 of them. But at some point, fiddling around on your own, you can actually do this. And remember, every knot you do in healthcare is a reef knot. Left over right, right over left. Okay, and then once this is on, nothing can hit my eye. It doesn't look great, obviously, but it works. Now what do you do if you don't have a metal cup? And even worse, you don't have a triangular bandage. Well, you should have an N95. And in fact, I would argue you can do this with any N95, and I'd also argue that these are actually a much easier thing to put on in the wild than a triangular bandage in a metal cup. It's going to keep the light from mostly getting in, it's going to stop anything hitting me, especially if I'm going through a forest or a smoky area, and it also particularly means that the person can't touch their own eye, which is why they like to use metal. You can also do this with aluminium foil. Get a piece of aluminium foil or aluminum foil if you're an American, and fold it to make a little dome. Once you've made your little dome, put it on, use a bit of tape. I had considered using Wolfie for this demonstration, but I'm fairly sure he'd object. Huples Cat's first golden rule of first aid is any procedures you may have to do, practice them on yourself, try and do them on yourself. It's a lot easier to do it on another person if you've tried it on yourself first. So again, do not put a huge big pressure bandage on there, certainly not an Israeli bandage, and tighten it up and have it tight there. No. If you see something sticking in the eye, don't pull it out. Pad around it gently and then cover it gently. If there's a lot of blood squirting out the eye, they've probably got an orbital hemorrhage. In the absence of emergency surgery, the best thing you can probably do is just to cover it up and wait for it to rot and fall out. If you see that the globe of the eye has got an obvious penetration injury in it, or you can see the globe's been ruptured, or you see the globe is now suspended outside of the orbit, there's not a huge amount you can do. But what you can do is give moxifloxacillin 400 milligrams by mouth every 24 hours. If you don't have moxifloxacillin orally, you can try using a combination of IV therapies. Cefazolin 1 gram IV every 8 hours and Levofloxacin 500 milligrams IV once a day. If you don't have these but you have IV ciprofloxacin, give 200 to 400 milligrams of IV ciprofloxacin every 12 hours. Now the approximate length of time to give these medications and the oral substitutions for cefalozin, ciprofloxacin and levofloxacin I will put in text. I don't recommend this, it's not really going to fix the problem, but at this point all you're really trying to do is to stop them getting an infection that then gets into their brain. If the eyeball's hanging out, cover it up, let it fall out itself. That's my advice rather than do surgery. Now if they have a corneal abrasion and you can see an obvious scratch, not a tear, not a cut, not a penetrating, but a scratch on the cornea, sunglasses is a good idea. Now one of the interesting things, and the question I did not ask, is do you normally wear contact lenses? If the person wears contact lenses, and there's many reasons why I do not, but this is one of them, they are much more likely to have an infection of their eye if they've suffered an eye injury. For this reason you want to start them on eye drops, and for this video I'm not discussing eye drops at all. It's far too complicated, there's far too many different types and you can really screw up by giving them. But if they normally wear contact lenses, try not to patch the eye. Covering it for transport's okay. If you see blood inside the eye or around the eye, and it's not traumatic, and even if it is traumatic, no lifting, no walking, no aspirin, no Advil, and nurse upright. This means don't lie flat in bed, it means sitting up with quite a few pillows. If you notice the white of the eye has gone red, this is a subconjunctival hemorrhage, and this is normally not treated. It'll go away on its own, the blood eventually will be reabsorbed into the body. But have a real good think here, is there any other trauma in the eye? If there's a huge amount of blood and the eye is bulging, have a gentle feel around here. There might be a fractured globe. The orbit, the bones around might be broken. So it's the same treatment, antibiotics. Can you see a gash, a tear, a cut in the eyelid, underneath the eyelid, in the eyeball itself, around the eye? Gently clean with sterile normal saline. Cover gently with a pad soaked in normal saline, unless they wear contact lenses. Now you might need to stitch the eye, suture it. I don't recommend that, I wouldn't go for that, I'm not going to actually try this. The idea of suturing somebody's eye without actually anesthetizing the eye with very specific medications is kind of bizarre to me. I don't think there's a lot you can do for most eye injuries other than the basics that I'm covering in this video. When you examine the eyes of a bright light, can you see objects on or in the eye that shouldn't be there? Well, if they're in the eye, there's not a lot you're going to be able to do about it, but if they're on the top of the eye, get a Q-tip and gently moisten it with sterile normal saline and gently try to get it out. Remember, the person's not going to be very cooperative, especially when you start touching their eye. Be very careful not to cause further trauma. If you're going to do anything like this, use a very strong light, use a magnifying glass, and be very calm. So general care for eye injuries in a disaster where you cannot get health care. Do not patch any eyes unless obvious tears and cuts. If they wear contact lenses, don't patch the eye. Never ever put a pressure bandage on them. Like, really just don't do this. If the injury is so severe they're squirting arterial blood out of the eye, then you might have to, but they're going to probably die. Cover all eye injuries with metal shields or N95s. It's probably a good idea to keep them covered because you don't want to actually touch the eye. The idea of a strong metal shield, not this, but this, is to stop them scratching their eye or touching their eye when they're asleep. Check the eye every 8 hours. However, you've been paying attention. Check both eyes every 8 hours. Never give Advil or aspirin or naproxen, Tylenol only, or codeine or morphine, nothing else. In general, I'm going to give moxifloxacillin 400 milligrams every day for about 7 days for all eye injuries. You probably don't need to. It's not going to help for some eye injuries, but I'm going to give it anyway. If I have it, I'm going to give it. If I don't need moxifloxacillin, and to be honest, antibiotics like that are very hard to get, I'm going to give oral doses of cefalozin and levofloxacin. I definitely will have oral Cipro, and I will give ciprofloxacin, but I will only be giving the oral doses. I'm not a doctor, they want you to give these IV. I don't have them IV. If I have them oral, I'm going to give them. Will they work? I don't know. Give them anyway. In general, use sunglasses. In general, don't bend, don't walk, don't lift, sit upright in bed, not flat. You may have heard of lateral canthoptomy and cantholysis. I'm not doing them. You might have the gear and the experience and the medications to do this type of thing. I never will. I won't be doing it. To be honest, most severe eye injuries in a disaster without medical care can result in vision loss and probable blindness. Be ready for that. This video has been brought to you by a Coughing Terrier Production 2024. Are you ready, Puff? Out into the cold. Thanks for watching. We'll give the dog some privacy. Have a great day. Doodles. Now, they want you to give IV. That's the gold standard. I'm not a doctor. I'm not a doctor. There is no healthcare. Sorry, that's just dog choking to death. I'm not a doctor. They want to give IV, and they want these to be given IV. Puff puff.